Tired of patients who only care about what their insurance covers? Or are those super nice soccer moms who fill up your hygiene schedule but never need anything beyond their twice-a-year prophy at a reimbursement rate that practically means you're paying them to be there? I'm Graham Dersley, and today we're diving into the third critical ingredient of a thriving dental career, attracting a steady flow of patients who actually want the services you love to provide. At Practice on Fire, we've identified 4 essential ingredients for long-term success. The only one dental school touches on? Clinical mastery. In a previous episode, I shared a step-by-step roadmap for developing the clinical skills necessary for a thriving dental career. While some dentists stick to crowns and fillings,
not that there's anything wrong with that.
No, of course not.
We advocate for expanding your skill set. Growing a practice is a lot more predictable when you can stand out from every other family dentist who specializes in periodic exams and the procedures that were taught in second year of dental school. Beyond clinical mastery, the 3 other ingredients, business systems, marketing, and case acceptance, are mostly ignored in dental education. In our last episode, we discussed the power of systems to transform a chaotic practice into a smooth, stress-free operation. Next time, we'll tackle the 4th ingredient, case acceptance, why a strategic approach to presenting treatment can be a game changer. Hint, even middle school theater kids rehearse their lines way more than most dentists have ever practiced case presentation. But today, we're talking about marketing, the lifeline of a thriving practice. Why most dental marketing falls flat. Let's be honest, most dental marketing is fundamentally flawed. Many marketing companies know that dentists care about one thing: how many new patients can you bring me this month? And the fastest way to fill a schedule? Discounts. This leads to patients searching for the cheapest cleaning in town, people who have little to no real concern for their oral health, and a revolving door of patients who disappear the moment their insurance benefits run out. This strategy might fill chairs, but it also fills them with low-value cases. Dentists end up spending their days performing exams on patients who either don't need much treatment or are skeptical of anything beyond a cleaning. Worse yet, when you do recommend necessary treatment, these are the same patients who accuse you of trying to fund your next vacation. The result? Frustration. Patients only want what insurance covers. People don't value dentistry. They just took an expensive vacation, but say they can't afford a crown. Sound familiar? The reality is, if you market to price-driven patients, you'll attract price-driven patients.
Almost as stupid as a stupid does.
A better approach to marketing. At Practice on Fire, we take a different approach.
I will do the opposite.
Instead of fishing through a sea of low-value patients in hopes of finding a few who actually need work, we attract motivated patients who are actively searching for solutions. These patients have a specific problem they want to fix. They're willing to invest in their health, and they don't need insurance to dictate all their decisions. With these patients in your chair, your stress drops and your production rises. Imagine a world where more patients come to you asking for treatment instead of you having to sell them on it. Many of these patients haven't been to the dentist in years, which means they often require comprehensive care. That translates into more quadrant dentistry, fewer one tooth at a time patch jobs, and significantly less running between hygiene rooms. And here's the best part. When you consistently attract patients who need treatment, you become less dependent on hygiene as a primary source of restorative work. Instead of juggling exams for multiple hygienists, one hygienist per doctor is often enough. Fewer staff, less admin, higher production with less stress. And these patients, they're not fixated on their insurance coverage. They want their issues solved now. That means you can charge fair fees without being at the mercy of insurance companies that prioritize their bottom line over yours. How to make it work? Here's where most dentists go wrong. Their marketing strategy starts and stops with, which marketing firm should I hire? Wrong question. Even worse, they ask, mailers or Google ads? Nope. The real question is, what is the message? First of all, define your ideal patient. Who do you actually want to treat? Be specific. Second, speak to their problems. If you want to attract more crown and implant cases, talk about broken and missing teeth. Ask if they feel embarrassed to smile. Highlight how missing teeth impacts their ability to enjoy food. Paint a picture of life after treatment, where they can eat, speak, and smile with confidence. We call this future, not features. Compare this to typical dental ads. We use cutting-edge technology. Check out our modern office. Here's a list of services we provide. Patients don't care about technology or equipment specs. They care about how you can help them solve their problems. Now, this strategy isn't just for major restorative cases. It also attracts regular hygiene patients, but now you're also bringing in a steady flow of people who already know they need treatment. Pair that with your existing patient base, and you have a sustainable growth engine. How long should you keep marketing? Always. Stopping your marketing is like shutting off your oxygen supply. A steady flow of new good patients, I should say, gives you options. Want to expand? Once you have more patients than you can see yourself, you have the option to hire more dentists and hygienists. But not everyone wants that. If you want to stay lean, raise your fees and let price-sensitive patients self-select out. Want to ditch PPOs? Go out of network and leave insurance headaches behind. Marketing isn't just about filling your chairs. It's about shaping your practice to match your ideal vision. And speaking of vision, what's the point of having great clinical skills, smooth business systems, and a steady flow of ideal patients if none of them are saying yes to treatment? That's exactly what we're covering in the next episode, Case Acceptance. See you then. This episode is brought to you by Practice on Fire, a platform dedicated to helping dentists like you conquer your most frustrating career challenges to unlock the path to a thriving practice. Here's the deal. We're all about sharing tons of actionable content for free. We want you to walk away with strategies that make a real difference in your career. But if you're ready to go deeper, to truly transform your practice and life, then our premium platform is your next step. What's inside? At Practice on Fire, we dive into the essential and often overlooked pillars of a successful dental career. Business systems. Build efficiency that frees you up to focus on what matters. Marketing. Attract the right patients, the ones who need and value your care. Case acceptance. Master the art of helping patients say yes with confidence. We've got hours of pre-recorded courses, but here's the game changer. An active community that guides you step by step through implementation. No more spinning your wheels in frustration. Think about it. Many dentists invest over 7 figures in their careers between student loans and practice ownership, but they've never invested in the critical skills that make the difference between struggle and success. Visit practiceonfire.com for free downloads, implementation guides, and details about how to take your career and practice to the next level. Want to take the hot seat? Think your practice could use a makeover? Apply to be a guest on our podcast. We'll give you an honest, no-holds-barred evaluation of your practice. Expect raw feedback, a breakdown of your numbers, and a tailored plan to tackle your bottlenecks. Vulnerability is required. Transformation guaranteed. Apply using the link in the show notes. All right, team, your transformation starts here. Let's light this fire.